So how do you make an office feel larger than it is? I'm sure that most of us have seen the video of the basketball passes and the gorilla. If your staff hasn't seen it, you should try it on them. It's a great way to explain that what we see and what we think we see are very different. There's a link to the gorilla video in this description if you want to check it out. Our brains constantly shorthand data. People that can't do this have severe emotional difficulties. So what does this have to do with your dental office? A lot, actually. When I started the journey to become the designer of the best dental offices in the world 30 years ago, I knew that the psychology of spaciousness mattered. But I wasn't sure how to combine that with the goal of building the most productive dental offices on earth. Aren't the two working in opposition? The good news is that these two objectives can and must be reconciled to create the ultimate practice. Here's the challenge. High productivity actually requires a certain compactness of space. Let's think about this for a minute. You could argue that the extreme compactness of a fighter jet cockpit or a Formula One seat are driven primarily by aerodynamics. But even the simple controls in NASCAR aren't spread all over the dashboard. Another comparison would be the professional kitchen. Do they lay it out like your dream show-off kitchen? No way. What you need in that kitchen is as close as possible to where you use it. This is central to our core principle. You can't use what you can't reach. So what does that tell us about what to do in practice? To answer that, we need to understand how people perceive space. What makes things look and feel bigger than they are? What makes them appear smaller? It's a science. Without subjecting you to years that we've studied this, okay, decades, I'd like to give you a few of the important principles that define how humans visually process space so that you can make your offices better too. First, when we enter a room, we don't have a laser transit in our brain. We can't actually measure the space, but we perceive the size of the room by the amount of open floor space that we can see. So the more busy crap and cabinets and furniture that take up floor space, the smaller we think the room is. That's why a wider room with side cabinets actually feels smaller than a narrow room without. Second, the depth of a room is largely determined by the brightness of the far wall. Brightness makes it appear closer. That can be manipulated in a couple of ways. For example, from the patient's perspective, you don't generally want them to have the room feel endless. As a patient, you're going to be lying flat and vulnerable. A certain amount of enclosure is actually good. However, if you're trying to make an interior treatment room with no windows feel appealing, so in this case larger, you'd want to brighten up that wall with lighting, artwork, or perhaps even a very large monitor. The third factor is this. If an area feels cramped, you can make it appear longer if you can intentionally and progressively reduce the size of artwork, displays, and furniture as you move further away. This will greatly enhance the sense of length. You can also use repeating wall stripes, but they're out of style these days. A more common problem in the dental practice is long, narrow hallways. We work really hard to minimize these by design, but we also are lucky enough to design some really big practices, so the tools to make larger hallways appear shorter are very helpful. One principle is to try to not enter the hall on its end. Reroute the crossover hallway into the more central starting position so that you wind up with what feels like shorter hallways. Hotels kink their hallways frequently, but you don't need to do that. Using this visual shortening technique is more challenging if you're putting your office in a strip mall. Here you use a combination of increasing brightness and focal point terminal display to shorten the perceived length. You can use these perceptual tricks to shorten the perceived length by about 25%. That's often enough to make the office feel less clinical. The last and very important principle that allows a great opportunity for creating an emotionally successful treatment room design relates to the sequence of how we, the patient, read a treatment room visually. This is where our early work with magicians comes into play. Early in this process, I actually hired one of the best magicians in North America, someone who had performed at places like Lincoln Center. Not a jokester type, but rather a classical illusionist. Think about that for a minute. If you now understand the principles of productivity, you know that we needed a more compact space to work efficiently on the smaller space of the mouth. But you also need to have plenty of space for supplies at your fingertips. Yet you still need to have the room feel spacious. Can you now see why we get very picky on our recommendations regarding how you fit out your offices? So how do people actually read a room? Here's how. When we enter a new room, our eyes move in a pattern in 1/10 of a second. This is how we can slip that gorilla into the video, or how a magician has you overlook something obvious in their trick. You see, the field of view that we take in during the initial scan is only 30% to the left and then very well defined after that. So by consolidating and pushing any scary, busy, or objectionable stuff out of that range of view, we've bypassed your patient's fear circuitry. If, in addition, you can push the dental light up and out of view, you do that with a track, you have an attractive end wall to catch your patient's focal interest. You'll have bypassed their fight or flight mechanism. This sets the stage for case acceptance. This sets the stage for a relaxed patient and treatment. This sets the stage for in-room consultation. So I'm thinking that this might also be a good time to clarify a misperception about my opinions regarding handpiece placement. It's been said that I'm opposed to over-the-patient handpieces. Actually, not true. They're the most familiar placement for graduating dentists. Schools use them because for all the money you spent, they were too cheap to give you a dental assistant. So you learn to grab everything by yourself for that one and only procedure you're doing that afternoon. You probably have enough room on the bracket tray for the stuff you need for that, but not in real practice. In addition, over-the-patient handpieces are the second most efficient placement location in general, but they also are the second most expensive installation, and they entirely screw up the concept of patient emotional security through the principles I've laid out here. Think about where they wind up in that fight or flight grid. This greatly reduces the success at in-room consultation, and for me even worse, prevents the use of surgical tables for performing bigger cases, surgery, sedation, and other complex procedures. So before you commit to the details of office design, consider the psychological safety and spaciousness. You'll be glad you did, and at least you'll be clear about the trade-offs that you're making with whatever you decide in terms of your setup. But also, please don't hesitate to contact us should you wish to learn more about how to create the most productive, comfortable, patient-friendly, and cost-effective dental practice. And thank you.